Everyone, thank you for your attention and to be presenting this session about my presentation regarding sepsis disease. My name is Ariadna Schuck. I'm from Brazil, but I currently just got my degree in South Korea, my PhD degree. So I'm from Sungkyunkwan University now, and I work in the nanoelectronic and microsensor fluidic laboratory. So my research topic that I would like to share with you today is regarding the detection, actually the quantification of multiple biomarkers for sepsis disease. So I will do a brief introduction regarding sepsis. Maybe many of you guys are not familiar with that disease specifically, but I'm sure you heard about that before. So sepsis is the body response to an inflammation or infection in the body. And there are multiple symptoms that occur during this response. And usually it occurs in the emergency department of the hospital. So it's hard for the doctors to identify this disease on time before the septic shock occurs. So sepsis has exactly three crucial stages: that sepsis, severe sepsis, and septic shock. When the septic shock occurs, the chance to survive is less than 40%, which is really serious, and the doctor has a really short window to treat the infection. But these require different type of laboratory tests to identify different biomarkers, because everybody has a different response to sepsis, because we all have different organisms. So the number of cases worldwide now is up to 90 million per year, and is one of most of the cause of death in the worldwide in the emergency of the hospital. So as I mentioned, there are multiple biomarkers that can be detected, and it can now there's around 42 to 47 like official biomarkers that can be targeted during the sepsis condition, but the doctors rely mostly on the key sulfate score that is related to some conditions of the human body, like heartbeat, respiratory rate, and or fever, for example. So the doctor doesn't rely exactly on a laboratory test to diagnose the sepsis for the patient during the 24 hours to 48 hours that they have to treat the disease. So my proposed approach for this quantification of biomarkers is to use a multiplexed device. So at first, I target only three main targets for this disease, and I target the C-reactive protein, the interleukin-6, and the procalcitonin. Usually, doctors target the lactate, but it's too common to publish or like investigate lactate these days. There are many devices that can use, but lactate just give like general condition, and you can't decide if this is sepsis or not for the patient. So what I'm trying to do is like that my multiplexed sensor can detect these three targets at the same time, where you're just using a small volume of blood. In this case, I'm just targeting plasma to avoid the coagulation of the blood over the active layer. Because if I have the coagulation happening, I can cause like increase of the impedance, and I'm not detecting the targets. I'm just creating a double layer over the active layer. So first thing I try to do is I have three working electrodes. Most commonly, I use titanium as a adhesion layer and gold as the working electrode surface part. And there is a problem that immobilization of antibody is not enough over that active layer. So the first thing I thought is, how can I improve that active layer properties? Then I decided to develop, I enhanced the carbon nanotube surface for my device. And then by trying to enhance that, I have to improve the dispersion of the carbon nanotubes and the uniformity over that surface. Then I can have a better active layer to immobilize the antibodies of the three working electrodes. And then I can target with the same microchannel. You can see here the microchannel. There is a same entrance. I think it's hard to see because this is PMS. But when I put the plasma sample around 20 microliters, the sample is called like flow through these microchannels and go over the 3 active layers. So I have a multiplex measurement for the electrochemical. I decide to use differential pulse voltammetry for this. And then I get a response that is proportional to the concentration of each channel that I'm using here. So after improving the carbon nanotubes with some biopolymer, I have many tests regarding it. I published last month in the Biochip journal regarding this study for the biopolymers. The best option that I found was polyarginine. That is the most biocompatible type, and it keeps the stabilization of the carbon nanotubes and improve also the dispersion. And this is just the schematic of how the carbon nanotubes are coated. And in the human plasma, in this case, like it's separate because we collected from the clinical medical center of Samsung directly. But we are proceeding with the clinical test with sepsis patients now. So I targeted 3 of them, 1 to 3 in the working electrode 1 to 3 here. And using Python language combined with fuzzy logic, I am creating a kind of system that can classify my 3 targets together based on some range, like this range of concentrations. And I can identify if the patient is severe sepsis, septic shock, that is the most critical points. So I'm combining kind of AI now for this diagnosis, but my focus here is just on the 3 targets first for the electrical chemical detection. So first, the enhancement of the carbon nanotubes. As I mentioned before, I already published this work in the biosensors, if you want to check the references here in the biochip. And then I compare the enhancement of the doped carbon nanotubes with thionyl chloride to increase the conductivity of the carbon nanotubes, also the active layer, because even I have a working electrode made of gold, when I coat that with carbon nanotubes, the conductivity will decrease anyway, because carbon nanotubes now conductive as gold. But I can improve this decrease of property by enhancing with the doping of thionyl chloride. And then after that, I coated the carbon nanotubes with polyarginine. And just to compare the improvement of the uniformity here, you can see the raw carbon nanotubes compared with the other polymers that I treated, also polyethylene glycol and PVP. PVP had a good response on the uniformity, but the conductivity decreased too much with the PVP presence over the carbon, around the carbon nanotubes. So polyarginine was the one that didn't affect that much the conductivity and also improved the uniformity of the surface, and also it reduced the defects. You can see there are many nodes here in the doped carbon nanotubes, but for the polyarginine one, you can see many of the nodes. And the decrease of the diameter was around 87 nanometers compared to the 67 nanometers for the carbon nanotubes. So next part is the morphological analysis. First, I check the aroma spectra to see if I can reduce the defects, as I can see in the same image. And based on the band of the aroma spectra here, you can see that there is a reduction in the peak compared with the bare carbon nanotube, which means there is a reduction in the defects of that nanostructure. And next one was the UVV's measurement. The absorbance also increased when I use the carbon nanotube with polyarginine compared with the bare carbon nanotube here. This means there is a more uniform dispersion of the carbon nanotubes over the glass surface used for the UVVs. And the most important part that is the electrochemical analysis. I want to guarantee that I have the signal amplification for the measurement, because anyway, I'm dealing with 3 different biomarkers that has many different concentrations in the blood. And some of them needs a high sensitivity to be detected. So I check the amplification of the signal compared with the bare electrode kit here in the redox response for the CV measurement. And the CNT here has an increase in the peak that was better compared with the bare electrode here. And next one was the Nyquist plot. The impedance also was the lowest, the total impedance was the lowest one for the polyarginine carbon nanotubes. So now for the real measurement, that is my multiplexed device. I measure the DPV response for the 3 working electrodes. And you can see here, these are my targets that I mentioned before for the sepsis, CRP, interleukin-6, and focacitonin. And I measure based on the range of the ELISA test that is commonly used to detect these biomarkers in human blood. So I consider this to compare the capability of my device compared to the traditional gold standard test that they use in the emergency of the department. And I got a linear response for the DPV peaks compared to the concentration of the biomarkers. And all of them has a high square R here of 0.99 for the 2 cases, and also the limit of detection. So here is the summary of the concentration that is also used for the ELISA, and the LOD, limit of detection, for the 3 of them. But as I mentioned, these biomarkers rise when the condition of the bioresponse for sepsis is getting worse. So limit of detection in this case is not that crucial, but still is necessary to prove that device has a low limit of detection. And I also include here the sepsis zone based on my Python, like the rules for my fuzzy logic included in the Python language. So I can classify this range automatically when I have the input data of the DPV curves. And then the validation with ELISA was also made to prove that there's a high agreement between my multiplex device and the gold standard test. So most of them have a high agreement inside the standard deviation of 1.96 there compared to the mean level measure. And for the future perspective of this work, actually, I am working my postdoc regarding it now. I'm matching my result, combining the Python language the script that I developed for the detection of the DPV curves with the Kisofa score that the doctors use, so I can have a more strong response for the report that the doctor can check quickly. And I guarantee that this measurement can be done in less than 5 minutes. And the last part that I'm developing now is 5 targets for sepsis. After the 3 targets, I decided to include more 2 targets, that is renin and lactate, because just lactate is the basic target for sepsis that the doctor checks. But renin is not well explored. Renin is the target for tissue perfusion. And when the patient reaches the septic shock level, the tissue perfusion starts in the body. So renin is the main biomarker for that, and also can help the doctors to regulate the blood coagulation and the blood flow too. So here in my plan is to create the 5 targets in the with microfluidic channel, sharing these targets in the plasma. And then after collecting DPV curves, the smartphone can produce with the Python script based on the rules for the fuzzy logic, a kind of report just predicting the stage of sepsis between the 3 types. And this is just how the program reads each curve. So I have 5 samples here, and these columns are regarding each working electrode, measuring these targets specifically with different antibodies in each active layer. And then by using the combination of Python with fuzzy logic, I can print this kind of a report for the doctor. So it's not necessary to use smartphone. I can combine it with computer too. But I think the smartphone facilitates the communication between like the nurse and doctor about the test, because a nurse can produce this test for the doctor if they request. So this is all for my presentation. If you have any question, please feel free to ask.